media briefing on the province's state of readiness, of course, as schools prepare to reopen for grades 7 and 12 learners. We take you there now.
Good afternoon. We welcome all of you, ladies and gentlemen, to this briefing. As you are aware, June is Youth Month, which gives us the opportunity to remember the youth of 1976 who stood up against the apartheid system and laid down their life fighting for the freedom and the right to equal education. This year marks 44 years since the uprising, and 2020 Youth Month is being commemorated under the theme Youth Power, Growing South Africa Together in the period of COVID-19. This is a call for young people to seek out opportunities for self-development and for participation in the economy through various government agencies such as the National Youth Development Agency and others. We take this opportunity to also congratulate the struggle stalwart, Ubaba Andrew Mlangeni, who is the only remaining Rivonia trialist who celebrated his 95th birthday yesterday. In 1961, Stralande Tata Mlangeni was among the first to be sent for military training outside the country, specifically in China. Upon his return in 1963, he was arrested after state witnesses told the court that he was one of the people responsible for recruiting and training an armed force for Umkhonto weSizwe. He was found guilty and sentenced to life imprisonment on Robben Island. He was released in 1989 after serving 27 years when negotiations between the ANC and the government started. As we enjoy the fruits of freedom today, we remain indebted to the people like him and many others who put their life on the line during the fight against the apartheid and other forms of racial segregation and oppression. Sitimpilonde, as we send our warmest wishes to his Twalando Siaparankwe, Tata Andrew Mlangeni. With regard to the briefing of today, COVID-19 status quo, up to today and including the 7th of June, in our country, the number of people infected with coronavirus stands at 45,973. There were 2,539 new cases and 952 deaths. The province of KwaZulu-Natal has itself experienced an increase in the COVID-19. The numbers of the infected people right now stands at 3,016. There has been 61 deaths experienced by the province of KwaZulu-Natal. The number of recovered people stands at 1,378. In eThekwini and Ilembe, the two districts continues to contribute more than 80% of the total cases provincially. And if you put them together, they contribute 2,465. eThekwini Metropolitan Council contribute 82% of the reported deaths, followed by Ilembe. Male patients dominate the fatalities with about 60%, and if you consider to be specific, it's 37 individuals. In terms of the age, the age for deaths is around 66 years, and we have experienced that they will range, people who died around 66 years will range between 39 to 91. In terms of the epidemic curve per district, almost all the districts receive daily new cases since the beginning of June, with the exception of Zululand and Umzinyathi. eThekwini Metro have been receiving new cases daily since early March. Umkhanyakude, Umzinyathi, Zululand and Herigwala are the least affected districts in KwaZulu-Natal. Distribution of cases and deaths by or per district. In terms of the analysis, we can now confirm that the majority of cases and fatalities are in eThekwini, and they come from the south and the north suburbs. Then it followed by the western part. Female cases continues to dominate with more than half of the confirmed cases, and that is 55% of the confirmed cases in eThekwini will be females. Among the new cases received on the 7th of June, slight more than half were males. The proportion of children continues to increase with increase in female cases. Male cases peak between the age of 25 to 39. Female cases peak between 25 to 49 years. In KwaZulu-Natal, we are observing a pattern that the majority of our cases are averaging between the ages of 25 and 39. In terms of the emerging trends, the districts of Ilembe and eThekwini continues to remain the hotspots, judging by the numbers of people infected and by the incidence risk. The overall incidence risk for the province was 13.8 per 100,000 population, calculating using active cases. Ilembe has the highest incidence risk at 47.4 per 100,000 people, while in eThekwini it shows an incident risk of 26.1 per 100,000 people. So you will see how Ilembe continues to be a risk and a hotspot, but even eTheku, you cannot put it outside that bracket. These two districts are followed by Umgungundlovu and Uthugela in terms of numbers. More effort is being put in place in all of these districts with a view that if we manage to control the spread, it will be possible to have an impact in the whole province. With regard to the progress we are making on screening and testing, the government through the Department of Health continues to do the screening and testing in all the corners of KwaZulu-Natal. We have as such screened more than 5.2 million, and we have tested more than 94,000 people provincially. A total number of 32,742 samples were tested from the community testing and screening. 353 cases tested positive, and that constitute 1% in terms of proportion. That said, we are still worried about the backlog in terms of the return of results. We are, however, aware that the Minister of Health is dealing with this challenge. With regard to hospital admission and isolation, on the 6th June, the province had a total of 327 patients admitted in both private and public hospitals. Of that, 39% were in private hospitals and 61 in public hospitals. Public hospitals continues to admit more patients than private hospitals. However, more patients admitted in private hospitals required intensive care, According to the latest data received, 22% of those patients are in ICU and are in ventilation. In terms of cluster cases, as the country progressed to level 3 and most of the economic sector started to become active, we have observed a rapid surge in cluster cases being reported. As at the 7th of June, we have recorded a total number of 259 cluster cases. Among those is 70 from one-tier companies and 120 from a warehouse retail, and 13 cases from a memorial hospital, 9 cases from the airport, and 47 cases from a production company. When it comes to strengthening the fight, we are mindful of the fact that to succeed, we need food soldiers and we need to build capacity in terms of beds. We also welcome the KZN Department of Health's effort in preparing the province for the period ahead. We expect that in winter, more people will display more flu-like symptoms, and as such, we will need the government to be more vigilant in managing those patients who will be coming with these and other symptoms and diseases. In this regard, we have prepared 7,111 COVID-19 ready beds all around KwaZulu-Natal province. We further authorized the Department of Health to employ nurses who are required to manage the increasing number of COVID-19 cases. Of course, the first is that these nurses should be employed for 6 months, and we will keep on assessing the situation. The human resource processes toward this have already started, and these personnel will be distributed according to the needs in different areas and hospitals. We are also pleased that we will see the creation of jobs in terms of this intervention. Among the other areas where these nurses will be distributed are Claywood Hospital, Richmond Hospital, Royal Showground Field Hospital, Durban Exhibition Centre Field Hospital. These are prepared by the provincial and national departments or Department of Health, with only the Durban Exhibition Centre that is still to be built. The rest are now done, they are completed. With regard to the impact of alcohol, as we have started the alert level 3, we have noted a sudden increase in the number of accidents reported. These may be associated with drinking and driving. We implore the South African Police Service to ensure that they arrest people who are not preserving law and who are not following the regulations. We are pleased to learn that challenges in the different hospitals are discussed between the unions and the department during monthly meetings that have been initiated. These meetings are led by the head of the department, and from time to time the MEC for Health will attend these meetings to discuss other pertinent matters. Among the discussions in these meetings will be the issue of occupational health and safety in the workplace. We welcome the progress made so far, and we believe that with good and sustainable healthy relations between unions and the department, we will be able to maximize our effort in fighting COVID-19. With regard to management of the positive cases, we are also worried by the increasing number of healthcare workers who get to be infected during the process of managing the virus. This has led to the department developing and distributing guidelines of how to manage the infection in the area where these workers would be working. We must say that the expectation that once an infection is confirmed in an area in the healthcare facility, then that area must close. That expectation is not correct. We follow guidelines. The guidelines give a clear indication on how each area must be managed once a case is found. The incidents where you see the rapid labor unrest associated with the infections of healthcare workers is discouraged. Employees and unions working together with management teams must engage and, guided by the guidelines, must discuss how to resolve each and every case. Besides the use of these guidelines, all staff and individuals getting into the Department of Health and other government premises will always be screened and their temperature will be checked every day. We ask these to be practiced in all areas visited by the people. We also ask people to be cooperative when it comes to these processes. We call for cooperation from all employees, including the Department of Education employees. The cooperation is also asked from the parents as well as scholars alike. We want to take this opportunity to also reflect on flattening the curve. So far, KZN has maintained a flatter curve and constant accumulation of cases. KZN initially had a high case fatality rate because of hospital outbreaks that involved many sick and old patients whose life was at risk because of severe diseases, and then the impacted or compounded by coronavirus. The number of deaths has since stabilized and correlate better with cases at a case fatality rate of 2%. In that, we are saying at some point the curve was going too high, but we've managed it now, and we've also managed the rate of deaths in the province. At this stage of the epidemic, we are monitoring very closely cluster infections, hotspots, so as to respond timelessly and contain spread of infection to a wide region. We are also working on identifying vulnerable areas in the province, and these will be identified through a vulnerability index that is currently being constructed, and we want to use this measure of vulnerability to stay ahead of the outbreak so that we do not only protect people who are at risk or severe or areas that are affected by severe diseases, but also areas at risk of severe outbreak. As things stand, we feel we have a better grasp of the nature of the pandemic right now. We cannot know how things may change as we go forward, but ours is to ensure that we are ahead in terms of preparations. With regard to schools opening, the province of KwaZulu-Natal, like the rest of the country, is scheduled to reopen schools tomorrow. KwaZulu-Natal is known as the biggest system of education in the country, with 6,148 schools, 90,000 educators, and over 2.8 million learners. Given the work done over the past month, the Department of Education in KwaZulu-Natal is now ready to welcome learners from tomorrow, the 8th of June. We've made sufficient efforts to respond to all the non-negotiable requirements and held consultative engagement with stakeholders in the education sector. In all the endeavors we have put in place, the priority is the safety of educators, learners, and all involved in the school management. And while we are moving ahead with opening of schools, it must be clear. The first priority is to protect lives. protect learners, educators, and all officials involved. Then ensure that we open so that we don't disrupt the academic year. We want to state up front that there will be no compromise to the safety and well-being of our learners and teachers. Should symptoms or a case be identified at school, the COVID-19 guidelines for schools will commence. This will entail conducting a risk assessment through contact mapping, tracing, and screening. Then, based on the extent of the exposure, a decision will be taken to either close or decontaminate. So we are ready in terms of the approach. So far, out of 6,148 schools, it is pleasing to report that over 6,044 schools are ready to reopen tomorrow, as they have met all the non-negotiables. A total number of 142 schools that are not yet ready and will be delayed in terms of opening, but they will be working toward also getting themselves ready, and soon they will follow. The department has procured the PPEs and other essentials for the next 6 months. Head office will keep a reserve stock so that they accommodate any eventuality, and will then deploy from masks and all PPEs needed as and when there is a need. Every learner, teacher will be screened as they enter the school premises, and data will be captured relating to temperature, comorbidities, and all the critical information relating to COVID-19. Screening and social distancing. With regard to that, the Department of Health and Social Development have made available 8,000 community caregivers for purposes of screening of learners and teachers. The Department of Public Works has allowed the Department of Education to recruit 6,000 EPWP, which is Extended Public Works, beneficiaries across the province to be placed in schools to do screening as well, since the learner numbers are high in many of our schools. Infrastructure has been provided to ensure social distancing. Markers are in place, and supervision will be done, since we are starting to bring back grade 12 and grade 7. So each school is properly demarcated in terms of queuing and lines, in terms of sittings. There are clear points which are marked for learners. With regard to supply of water, we've noted that there are schools who are still facing a challenge in relation to water provision. The challenge is not just a school problem, but arises from a bigger problem of water provision within the broader community. It must be noted that KwaZulu-Natal is a water-scarce province. The most challenged districts are Zululand, Umkhanyakude, and Ugu. We've entered into agreements with the municipalities, and a timetable has been created to ensure that schools have sustainable water supply. In addition to this effort, the Department of Basic Education has appointed Rand Water and also enlisted the services of South African National Defence Force to ensure maximum supply of water to all our schools. We have provided mobile classrooms in 10 schools. 3 of these schools were vandalized during the national lockdown period, and 7 were damaged by storms. The number of mobile classrooms that are provided so far are 28. All the contractors have complied and completed the installations of these mobile classrooms. With regard to the plan to repair the 3 banned schools, the implementing agents for the following schools have been appointed: Bambazi High School in Uthukela, Edgeton Primary in Herikwala, Mzuvele Secondary in Pinetown District. The repair works are anticipated to commence on the 15th of June. With regard to the mobile toilets, the Department of Education is servicing mobile toilets in 461 schools. The number of mobile toilet units being serviced are 3,607 schools. With regard to the orientation, we're focusing on management, teachers, as well as the plan for learners orientation. We have conducted COVID-19 orientation to most of our education employees, and this will continue on a regular basis, covering also learners, teachers, and the entire school management teams. For this purpose, the department has recruited 475 screeners. Most vehicles have also been provided with disinfectants, hand sanitizers, and thermometers. Driver assistance will be provided as well to ensure that they support all buses during the transportation of learners. The National School Nutrition Program has appointed service providers for all clusters, and service providers have delivered adequate quantities to all schools. Cleanliness is key in all areas, be it where we prepare food or even in classrooms, and training programs are conducted annually. As such, all current food handlers have been adequately trained to maintain personal hygiene and to preserve their all areas in a manner that is expected. This will include ensuring that they adhere to wearing of masks, wearing of gloves, using surface sanitizers, use of hand sanitizers and washing hands with soap and water, practicing social distancing. So we've put in place a comprehensive plan for our schools to open. In conclusion, given the work done by the Department of Education, working with all stakeholders, the provincial government is confident that schools in the KwaZulu-Natal province are ready to welcome learners on the 8th, which is tomorrow. All learners who will be coming back, we're saying we wish them well, but also we would want to emphasize, let us also follow all protective measures that have been put in place. With that, I think I've covered a lot, but thank you. That has been comprehensive reporting. Thank you.
Thank you very much. We'll quickly check the questions, and also the MEC for Education will be among those that will answer the questions. Can we have an indication of hands? Daily Maverick, you're one. Eyewitness News, number 2. Another hand? Let's see. Okay, let's start with Daily Maverick.
Hi, Daily Maverick. This is Education. So I just want to give some clarity. We obviously ran a piece about the pricing that was used about PPE. It was presented before KZN legislation. It was quite clear that those were the prices that were given. I'm sure you've seen the piece. It talks a lot to the fact that those prices were right on the maximum limit of what the Treasury was asking. And I'd just like to find out, why was the economies of scale not used in buying for KZN? I mean, with such a large student body, surely better prices could have been obtained to sanitize. So personally, I phoned one producer who makes a 5 litre for 230 rand, 70% alcohol. And we're selling it at the market's buying it at 400% more than that price. I know the producers, we don't know warehousing, but surely economy of scales would have reduced that price. And at this point, that's all, I think, for you all. Thank you.
Okay, next colleague.
Good afternoon, Premier. My name is Koskona Duma from Eyewitness News. Premier, I would like to get clarity on the plan for learners who are in the schools that won't be able to start tomorrow, what exactly would happen to them? In regard to scholar transportation, you had previously indicated that social distancing will be implemented as far as that process. Now, we understand from the MEC's budget votes that took place this past week, there are about 58,000 learners who are benefiting from that program, but the waiting list has over 117,000 learners. So what's the plan there with regard to ensuring that safety measures are adhered to there? And also, can we get clarity, MEC, on the stolen PPE? We know that it ran into the millions. It wasn't clear how much of it was stolen. We also hear now that it has reappeared. So what exactly happened there, and who's to be held accountable?
Thank you very much. We'll hand over to the Honourable Premier for this round to start the response. I know there's a question that is asked by Health, but we'll hand over to the Premier and the MEC to respond. Over to the MEC.
Well, thank you. Do I need to open this? Thank you so much, Mr. Premier, and to all the colleagues. I think on the issue of the pricing of PPEs, the slide that is circulating demonstrates the prices as determined by National Treasury. And it's a slide that we presented to the Portfolio Committee to say National Treasury has determined the maximum price per unit, and further said if something that you want to buy is above this price, you must escalate the matter to national. And the setting of maximum price was done after the realization that given the demand that was outweighing the supply, the prices were shooting up in terms of the COVID-19 essentials, and I'm sure all of us are aware of that. And National was proactive to say it issued actually instruction note, it started with instruction note number 3, and then it complemented that with instruction note number 5. And number 5 was specifically saying the maximum purchase of each unit is this amount. And that is the slide that was presented to the Portfolio Committee, which is now circulating. The report that I have received from the CFO and the HOD is that there is no price, there is no unit, there is no item that was purchased at a maximum price. And that report, tomorrow we're sending it to the Premier as well as to Treasury, because we also want Treasury to do its a post-audit. Those of you who may have read the instruction note number 5, it does indicate that for 3 departments in fact, and one of them is Department of Education, Treasury must do what is called pre-audit before orders are issued, and that was done. And after that, they need to do post-audit so that they ensure that there was compliance with everything as per the rules. And the provincial executive, particularly the Premier, was very emphatic to say we need to negotiate prices and try to get as low prices as possible. And the report that I have received does indicate that there was serious work done by the department in terms of negotiating the prices of units, the prices of delivery, the prices of warehousing, and all of those things. And that report, as I'm saying, we are giving it to the Premier as well as the Provincial Treasury tomorrow. And from there, we are going to be getting guidance from the Premier on how then do we ensue with communication. But I can assure you, there is not a single item that was procured at a maximum price. And once the Premier releases that report, it will be demonstrating item by item how much was it procured for, and what process was followed in that regard. So the slide that is circulating, it's a slide from the National Treasury. Those are prices from National Treasury, applicable to all the provinces. We understand that for some mischievous intentions, we have been accused of having procured at a maximum price, which is actually not the case. The plans for, okay, let me first deal with this one on the missing PPEs. I normally hold evening meetings with the district directors just to check the state of readiness for each and every district. And the first report was from the HOD to say all the masks in particular were procured, and the other stuff, as the Premier was indicating, were procured for 6 months. And we had sent to district offices and circuit offices and to schools that which will last them at least for 3 months from now, and then we'll be adding on because there are challenges of storage in district offices in schools. So we could not send everything at once to those places. So in this meeting, 3 directors indicate that there is a shortage of masks in particular. Zululand in particular was saying about 40,000 masks are not, they are short of 40,000 masks. And I think Umlazi as well as Pinetown districts, it was about 16,000 combined of those 2 districts. Now, our worry was that the HOD presents a report that suppliers have reported delivery of these masks. But districts are saying they are still short. So what do we do? Because districts are arguing that we need more masks. Now, for us to procure, to protect the public purse, because we are presiding over the public purse, I then say to HOD, because if we don't replace this, it means our schools will not be opening, because these are part of the non-negotiables. So before you even start any process of adding or of procuring more, we need to an external investigation so that we understand exactly what happened. We don't want this matter to come now through the whistleblowers and all of those things. And I said to HOD, because of the need to be transparent in this process, we need to go out to public and report this thing so that we don't find ourselves accused of having food matters under the carpet and all of that. We went out and communicated to the public, including the institution or instituting this investigation. The following day after we have made that public announcement, we got a letter from Zululand district to say no, the 40,000 masks which we said were short of actually have been delivered, and they were signed for by someone when they were kept in another storage. They were using 2 storages in a district. Now, my attitude to the HOD was that they must then go and account to the investigator as to how did we arrive at a situation where we're almost made to procure additional PPEs when actual delivery was made. So we're at that stage. The investigation is continuing, and once we know the findings as well as the recommendations, we will present that report to the Premier, and we will go to public to say this is exactly what we found, because we were almost made to incur additional expenses when something were actually delivered. And we have even said the investigation must look into the whole project, so that if there are other possible irregularities that we may not have discovered, it is able to tell us, to say probably here there are irregularities or whatever that it may find. And we want to act expeditiously, and we don't want to wait for what is called whistleblowers and all of those things. We are presiding over a transparent process and want to be transparent throughout the way. On the social distancing in the scholar transport, in particular, for now we're bringing back grade 12 and 7, and for any scholar transport, you don't find a bus full of grade 12s only, or grade 7 only, grade 7s only. It will be a mixture of all grades. And that is why we're saying there will be no headache in terms of social distancing, particularly in this period. And all scholar transport will be sanitized, will follow all the precautionary measures. We have even employed the screeners that will be traveling with this scholar transport so that a learner is screened before he or she enters the bus. So between now, there will be no challenges. But also going forward, we have tried, or we're trying to mitigate against that situation. Yes, we're transporting 58,000 learners with 117,000 still on the waiting list. But as we phase in other grades, we're not going to phase them in completely at once. You know, we have 2.8 million learners premier in the system, and it will just not be possible to have all those learners back in school at once. So we're looking at 3 options in particular, because the principle is that at any given time, a school must operate at 50% capacity, so that it is easy for us to manage the issue of social distancing. So any school, or all the schools, should be operating at 50% capacity. But how then do we achieve that? We're looking at 3 options. The first one is as we phase in other grades in July, we're looking at platooning, where other grades may come in the morning and leave, and then others during the day and leave in the afternoon. The second option is to what we call day shift, where we bring grades in different days. Other grades will come on Monday, Wednesday, and Friday, and others will come on Tuesday as well as Thursday. And those who would have come on Tuesday and Thursday this week, the following week will come on Monday, Wednesday, and Friday. And they will be given enough work for them to be kept busy while they're at home. The third option will be the week shift, where certain number of grades will come for a whole week and be given enough homework for the following week. And then the following week we bring other grades, so that we always ensure that a school is operating at a maximum of 50% capacity, as it were. And the last question was in relation to the schools that will not be ready on Monday. As of today, this morning, we calculated that the schools that will not be ready are 104 in the province. And the problem is just water in particular. And water is a basic necessity. The Premier spoke at length about the issue of challenges of water in Mkanyagute, Zululand, Uku, as well as Utuga. And most of these schools, you find them there. And we have agreed all in the sector that where there is no 100% compliance, that school will not be open. The Premier was very emphatic that it's life first, then everything else. So we're protecting the life and limb of our teachers and as well as learners. So if by tomorrow, because even the work is continuing today, these schools still don't have water, they will not open. And what we have said to district directors, work with principals as well as the scholar transport, because for now we'll not be using 100% of scholar transport. So those learners who will not be, or whose schools will not be ready by tomorrow, should be transported to the nearby schools, so that they don't get left behind in terms of curriculum recovery. So the district directors working with circuit managers and principals, they need to identify schools that will have enough floor space to accommodate learners from any school that will not be ready. And we're anticipating that at least by the end of this week, by Friday, we should be completed with the provision of water in all our schools. SNDF has come in very handy, and I realized yesterday, Mr. Premier, that at 12, I was told they were still working, 12 midnight. And I'm saying these are soldiers of our nation, really. At 12 midnight, they were still installing tanks and putting water in some of our schools. But we are also in engagement with National Department of Education and Rand Water to say, so that there is not a single day where a particular school will be without water. We need water tankers that are dedicated to schools, because municipalities have indicated that they have a challenge to service communities at a rate in which they want. Now, with the burden of schools, their capacity will be depleted, in all honesty. So part of our engagement going forward is that Country Rand Water and National Department of Education provide specific water tankers that will service schools, so that we don't find ourselves a situation where a school is without water. So I think, Mr. Premier, those were the questions that were asked. Thank you so much.
MEC, we welcome the MEC for help. Can you take another round? Allow the Premier to also respond. Maybe let's get a response from the Premier, then we take another round. Oh, SABC, Sheila, and then Terry Maverick. SABC, you're first.
Hi, it's Nonjabulo Mtunga Makamo from SABC Radio News. I have a question for the MEC for Health. MEC, the SABC here in KZN has been contacted by some of the 160 cruise members who were quarantined at the Coastlands Hotel. And they have been telling us that they were living under appalling conditions. We just want to find out what is the criteria that is followed, to ensure that the facility that has been identified for quarantine is suitable.
Okay, Sheila. KZN.
enziwasebenzisa angazi ngathi njengathi uthi uma ngabe seyingane sekuyela ngokusikoleni ukuze tukwazi ukumanejale i-percent capacity. Manje ngibone kubale indlela ey'ntathu lana yokuthi kube nama-shift day ekuseni nantambama, or kube nale alternative days, or kube nale alternative days. Now ngikwazi ukuthi mhlawumbe ngicabanga ukuthi iyona ezogcina yenzeka kulawo mathathu.
Thank you. Del Maverick.
Good afternoon, ladies for help. Just I've got one for the MEC for help and one for the Premier. For the MEC, please, if you could just, those 7,111 beds or places, are those available as we stand right now? Or are those some of them perhaps in the pipeline? Is that only within the state, and does that exclude? You spoke at your briefing on Friday. Does that exclude the 4,000 that you're anticipating getting from the lodges and B&Bs for quarantining purposes? And I imagine it's excluded private. And then for the Premier, has a discussion come up within your cabinet meetings about municipalities? They're all going through budget processes right now. There is concern that a lot of them are passing increases for councillors and staff during this particular time, and whether you've at least had a discussion with your MEC for cooperative development to engage with municipalities to trade on that topic a bit more gently. Thank you.
Over to the Premier.
No, thanks. I think we'll take the last question, and then allow the MECs to deal with issues that relate to their line functions. With regard to municipalities, both in terms of passing of, I think it's in relation to their grades and salaries, we are dealing with that matter through MEC Shomuga for court. We've heard about it. It goes through stages. The municipality can then propose to the MEC. The MEC must consider that and then approve. Now, it has come to our attention, we've discussed it, and we requested the MEC to take charge of that process. And I don't believe it will be will allow such escalations that are reported. But let's allow the MEC to deal with the matter. You are free to interact with COGTA, and I'm sure they will tell you that we've discussed the matter, and there is an approach that COGTA was mandated to employ in dealing with that. Thank you. Okay.
Good afternoon, ladies and gentlemen. I don't have a lot of questions. Let me start with the Coastlands question. Firstly, the facilities that we are utilizing as quarantine are not, we just don't wake up in the morning and decide this is the area we're going to utilize as quarantine. Firstly, we identify areas in each district, each city, and then we send a team of people that are going to go in and investigate, which include people that are responsible for inspections, infection prevention, our nurses, our doctors, and so forth. So Coastlands is not an exception. When it was identified, we did the same thing. It's not the only facility that we have in eThekwini that we have identified. It's also not the only facility that we have identified in the province that relates to quarantine. Now, when we identified this area, this was a facility that had, in terms of cleanliness, in terms of the beds that we needed, in terms of the things that we needed to add, because in other facilities from time to time we needed to add a few things here. They're not necessarily things that were relating to infrastructure, but things that were in relation to the human resource that needed to be there. I must indicate that it's very unfortunate that the team that eventually stayed there last week had the issues that it raised. From where we are sitting and from our knowledge, Coastlands is a very clean hotel. By the way, it's a facility that we have been utilizing for quarantine for the past 3 months at least as a Department of Health in the province of KwaZulu-Natal. Now, the fact that there were challenges that were coming from just this particular group is of serious concern. I must indicate that this particular group also brought in alcohol with it from the vessel that they were traveling in. And when the security people that were in the facility raised the matter with them, that is when the squabbles started coming in. But I think it's an issue we don't want to really get involved in or into detail in. But we hope that the national departments in future, when they bring in people into the facilities that are in the province, they will bring the province on board so that we are also able to manage the facilities together, and where it's needed and it's necessary for us to add the security, we are able to do so. The same group that was there did not adhere to your quarantine rules. They were coming in and out of the facility as they deemed fit, which is some of the reasons that made it difficult for the facility to manage their stay in the facility. Having said that's a matter we are probably going to have a discussion with our own Department of Health in the Department of Public Works in the province and the National Department of Public Works. But I think I have explained the fact that any facility that we utilize as quarantine area, we go in before and we conduct a proper assessment. I'll give you an example. There is one facility that we had identified as a department here in eThekwini again, and on assessment, there was an issue that was raised that particular hotel or lodge was sharing a passage with the Department of Labor. We had to bring our people in, and they went through it, and it was agreed that when you close this particular door and this passage is shut down, there was not going to be an infection. So every facility that we utilize actually has an investigation that is conducted before it is approved, because every facility must be approved. Let me then speak to the 7,111 beds that we speak to. These are beds that are including isolation and quarantine beds. Now, in quarantine beds, as we've been indicating earlier on, we are speaking in majority
majority by about your hotels, your lodges, and so forth. And of those 7,000, about 2,200 are your quarantine beds, because in the quarantine beds you don't often have people staying there longer, so the turnaround time is quite quick. When we started with, so with the rest of the beds, these are relating to our own beds in our own facilities. They are relating to the field hospitals, if you remember, that we spoke to, which in this instance speaks to Royal Showgrounds in Mkungundlovu, it speaks to the Durban Exhibition Center here in eThekwini, and of those, the Durban Exhibition Center on its own is giving us 450 beds, Royal Showgrounds giving us about 290 beds, so it is quite a number, but these also include the beds that we are getting out of Pixliga Isagaseme Memorial Hospital, because we get 450 beds out of there. So of the 7,000 beds, the majority of the beds are available. When we started with our reconfiguring process, in the province, we only had 230 isolation beds, not wards, but only 230 isolation beds. But by the end of June, we are going to have the total, we are going to have more than 2,000 isolation beds, because we have started reconfiguring the different facilities, as I have indicated earlier on. So we are getting quite a lot of beds from the work that we have done in our facilities. The good thing about it is that these are beds that we are going to be able to utilize in the future as well, once we have conquered the COVID-19. I think those are the two questions that were raised. All right.
No, thank you once again. And I think on the first question, on the preferred three options, let me first indicate that grade 12 will be in school throughout, so it will not be affected by these three options that we are considering, because they will be assessed on full curriculum and content. So grade 12 will be in school from Monday to Friday, and any additional days which we may agree on as a sector. Then we are more inclined with regard to other grades on the day shift. Obviously, we still have to finalize that matter with the minister, in consultation with the minister, and that takes account many other things that we had to consider. And amongst them is the issue of school nutrition. We are already under pressure to say, why are we not feeding learners that are not at school yet? Number of pressure groups are even threatening to take us to court, to say, as you open on Monday for grade 12 and grade 7, also open for all learners to come to school, to eat and then go back home. And we have been grappling with this matter to say it's a difficult matter. At least let us settle with grade 12 and 7, prepare the system well for the phasing of other grades. Now, if you, for example, say you alternate them per week, it means for the whole week there will be learners who will have no access to nutrition. So that is why I'm saying we are more inclined to day shifts, because at least there you can manage it better, rather than to send learners home for another week and then they will not have access to the school nutrition. So if you do it on day shift, we think the situation will be more better compared to week shift. But there are a number of other pros and cons that we are considering. And once we finalize our submission, we'll then have to consult with the minister and then get the final approval on in that regard. The issue of teacher unions, if they've been consulted, I think I need to indicate that we are working now very well with the teacher unions and SGPs. If there is a period where we are really facing one direction, it's now. And we have really put all our differences aside and said, let's work for the common good of the sector. And for the past 2 weeks in the province, I can say we have been holding regular meetings with unions as well as SGPs. The last one was yesterday. We started at 6 evening yesterday. And we all agreed that it's time that those schools that are ready should open, and those that are not ready, we should not open them, but within a week we must have sorted everything so that by next week all learners go to their schools. But in this week of final mop-up and interventions, we need to find a way of ensuring that those learners who are attending schools that will not be ready are not left out in terms of curriculum recovery. Hence, I spoke earlier on about rerouting some of the scholar transport, so that it takes those learners into other schools that are ready and with enough floor space. So we really want to thank the leadership of unions as well as the SGPs that we have been able to put whatever differences that we may have had aside and work towards the common good of the sector. For the past 2 weeks, it has not been an issue of a debate between us and the unions to say this one is not ready. In fact, we agreed on a process of verifying together. All schools were verified together to say at a second level, this school is not ready, this one is ready. If it is not ready, those committees which were composed of unions, government officials and SGPs were able to make interventions there and there. And that was the spirit in which we have been moving on since the past 2 weeks with the unions. We are meeting again tomorrow to check the opening of schools and if there will be any challenges insofar as the opening of school tomorrow is concerned. But what is pleasing is that we have collectively agreed that where there is a challenge, we intervene there and there together. There will be no one who will say, I will wait for a particular meeting to raise that in a particular school. There was still a challenge of water and all of those things. And we are hoping that we'll continue with this trajectory and be able to phase in other grades within the spirit which is now dominating the relations between unions as well as the department. And even at a national level, after the meeting, we had a meeting, CM together with all the stakeholders at 2 o'clock yesterday. And you could sense that we are now really working as a unit in terms of preparing for the sector. So we are working, and the unions are aware of the pronouncements that were made by the Premier today, as well as the challenges that are still there in our schools. We have been upfront insofar as those challenges. Yes, the schools that are not ready in the main are in rural areas because of the historical challenges. But we have also started to be worried about some incidences where you will find that a tap of a tank gets broken and then by the time the municipality wants to put in water, the water will gush out, and other tanks they will just poke holes on the tanks and leave. So we are working with the law enforcement agencies really to try and close that gap. Otherwise, it's one of the major risks that we are facing as a sector. The issue of attack in our schools will constitute the major risk as it were. Thank you so much.
Masiphinde sibonge kunina nonke sibingelele ngokukhulu ukusithoba kunina nonke enikhona. Namuhla sihlangene ukunikezela i-update ngesimo sobhubhane esibhekene nezwe i-COVID-19. Noma sihlangene ngalokho kubalekile ukuthi siqale ngokhalalisa ukuthi umzabalazo ukulwisana nezinselelo ezibhekene nentsha uyaqhubeka. Sikusho lokho ngoba siqala inyanga kaJune esiyaziyo njengenyanga yentsha eSouth Africa. La abafundi ngo-1976 basukuma bama balwisana nombuso webandlululo befuna imfundo elinganayo for bonke abantu base-South Africa. Belwela futhi imfundo eyiyo eyiquality eyolekelela ukuthi abantu bakithi babe neqhaza abadlalayo enhlalweni nasesimeni somnotho wezwe labo. Kulonyaka kuyobe sihlanganisa 44 years since Soweto uprising. Sizokhumbula unyaka ka-1976 ngaphansi kwesiqubule sithi amandla entsha sisonke masikhulise iSouth Africa ngaphansi kwalesimo sengcindezi ye-COVID-19. Siyakholwa ukuthi ngokubambisana nezinhlaka zolusha sizokwazi ukuqinisekisa ukuthi umzabalazo uvulela intsha yakithi amathuba omnotho, amathuba ezemfundo nokwakhiwa kwamakhono uyaqhubeka uphumelele. Siyafisa futhi egameni likahulumeni waKwaZulu-Natal ukudlulisa umyalezo ukhalalisela ingqalabutho yomzabalazo isithwalande ubaba uAndrew Mlangeni njengoba ubegubha usuku lokuzalwa izolo ehlanganisa 95 years. Sibone likhulu kwigeneration yabo benoMadiba noSisulu nabanye. Sithi kuye mpilonhle mpilonde. Ngokwesimo lesesibhekene naso sobhubhane lwe-COVID-19 singabeka nje kafishane ukuthi kuze kube namuhla kunabantu eSouth Africa abangu-45,973 aba-affected abahaqwe yilesi sifo kumbe esebeke batheleleka ngalesi sifo. Lapha KwaZulu-Natal abantu ababanjwe yilesi sifo bacela ku-3,016. Ngonjalo futhi ngobuhlungu sesilahlekelwe abantu abawu-61. Indawo ezisahamba phambili ngalesifo indawo yeTheku neLembe. eThekwini iNorth neSouth ilandelwe ke iOuter West. Masisho ukuthi iLembe libonakala ibalo uma ukhompera ngokwabantu abangu-100,000 izibalo zakhona zingezinhle zithusa kakhulu. Singasho ukuthi ngoJune sibone wonke ama-district ereporta ama-cases amasha usuku nosuku ngaphandle kweZululand noMzinyathi. Siyafisa ukuthi sisabalalise futhi siqinise uhlelo lokuqinisekisa ukuthi abantu bayaskrinwa futhi bayathestwa ukuze sikwazi ukuthi sonke sibhekane nalesi simo. Singasho ukuthi abantu esebeskriniwe bangu-5.2 million kwathi abangu-94,000 bathestwa ngalesi simo. Siphatheke kabi ukubona ukuthi kwezinye indawo especially zezibhedlela kukhona abahlengikazi nabasebenzi bakahulumeni abathelelekayo ngalesi sifo. Siyafuna ukusho ukuthi akuthi ngoba sekukhona umuntu othelelekile bese kuba ukuthi sekudinga kuvalwe isibhedlela noma leyo ngxenye, kodwa siyachekisisa ukuthi siscreen ukuthi uthintane nobani, ubephi, ubesebenzela kiphi indawo. Mhlambe mase sibheka lezo ndawo abesebenzela kuzo ukuthi zidecontaminate ukuze sikwazi ukuqhubeka sisize abanye abantu. Ngingaqinisekisa ukuthi silungise ukuthi ngoba siya esikhathini sobusika la ukulindeleke khona ukuthi inamba yabantu abaphathwa umkhuhlane okungenzeka futhi batheleleke ngalesi sifo inyuke. Yingakho ke sesilungise imbhede ewu-7,111 So isibalo sembhede yonke ebekelwe i-quarantine ne-self-isolation. But ngaphekwa lokho ikhona into entsha esiyibonile njengoba sekuvulwe ukusebenza komnotho ku-level 3, iy'mboni ey'ningi zivulwa. Siya ngokubona ama-cluster cases. Lokho esikubiza ngama-cluster cases la ubona khona abantu besebenza endaweni eyodwa betheleleke ngobuningi. Khona inkampani eyakha amathayi enabantu abawu-70 already abathelelekile. Kunekampani ye-warehouse egcina izimpahla ereport abantu abawu-120 abathelelekile. Kunesinye isibhedlela esinabantu abawu-13 abathelelekile. E-airport abantu abathelelekile bawu-9 kuze kube manje. So zonke lezi zinto ziyasikhombisa ukuthi la abantu behlangana khona kuba possible ukuthi batheleleke ngokusheshsha, and kubalekile ukuthi kube neindlela ezibekwayo eziclear zokulandelela ukuthi abantu bayasebenza social distancing, bawashe izandla, maqede basebenzisa ama-sanitizer. Enye into, ama-cases ey'ngozi aya ngokunyuka since kuvulwe ukuthi notshwala sebungadayisi. Lokhu-ke kusiphatha kabi ngoba kungenzeka ukuthi iy'ngozi ey'nyukayo zikhandwa abantu abashayela bephuzile. Sizocela amaphoyisa ukuthi aqinise isandla kulokhu. Ngasho nje ukuthi KwaZulu-Natal in terms of ukukhula nokutheleleka kwabantu siyakwazi ukumanage, sesimanagile i-curve is not going up, ayiphezulu kakhulu, kodwa siyakwazi ukuyibamba manje ukuthi iy'namba zabantu yebo ziyanyuka, kodwa at the same time ayinyuki ngendlela ethusayo. Sesikulungele ukuvula izikole njengalokho ungqongqoshe a-announce umama u-Angie Motshekga ukuthi kusasa mhla ka-8 June izikole ziyavulwa. NjengekwaZulu-Natal sibeke phambili ukuvikeleka kwempilo yabothisha nabantwana nabo bonke abasebenza ezikoleni. Lokho kuyinto yokuqala esiyibeke phambili. Yingakho sifisa ukusho ukuthi la sithola khona ukuthi kuba necase ereportwayo ngeke sangabaza ukungenelela ngokusheshsha ukuze abafundi nothisha bavikeleke. Nokunjalo inhlelo zonke zibekiwe manje ukuthi abafundi uma beya emabhasini azobayisa ezikoleni kube ne-social distancing, emaklasini abazofundela kuwo kube khona i-social distancing, khona ama-PPEs okuyizifonyo lezi ezisetshenziswayo, ama-mask nezinto zokwazi ukuwasha izandla noma ama-sanitizer. Iy'ndawo ey'ningi seyifakiwe futhi amanzi nama-toilet. So ngokuphelele njengamanje singasho ukuthi ezikoleni ebeyilindele ukuthi ivule kusasa ezingu-6,148 u-6,044 usukulungele ukuvula futhi usukwazile ukuhlangabezana nayo yonke imigomo ebekiwe ukuthi uma isikole zivula kudinga sibe sesenzeni nani. Izikole ezingu-104 ey'ngakakulungeli ukuvula nazo zizobe ziqhubeka nohlelo lokuyilungiselela ukuthi ivule, and maduze nazo zizovula. Siyafuna futhi ukuncoma nokubonga ukubambisana between umnyango wezemfundo nothisha nezinyunyana zonke ekutheni kwazi ukuthi kulungiselela ukuthi uma kuvulwa izikole zivulwa sonke sibe sesicheckile senze i-assessment eyiyo yokuthi isikole nesikole ezivulwayo sikulungele ukuthi abantwana nothisha babuyele ezikoleni bafunde. Sibafisela inhlanhla, siyacela kubo bonke ukuthi masizinakekele nakubantu-ke bakwaZulu-Natal bebonkana. Sisaqhubeka sihlaba ikhwele lithi lesi sifo asiyisukeli size kumuntu, kodwa kuba umuntu either oya kuso kumbe asithathe mesizidlulisela kwabanye. Indlela engcono ukuthi siqinisekise ukuthi i-social distancing ibanga eliba phakathi kwakho nomunye umuntu, ngabe uyamlandela esitolo, kungabe uyamlandela etekisini, ibanga malivuleleke ngokwanele kube ngaphezulu kuka 1.5 meters, but thina sikhuthaza u2 meters. Ngaphekwa lokho siyacela kubantu bonke bakaZulu-Natal asiqhubeke nokuyivikela ngokuwasha izandla ngamanzi nensipho noma sisebenzisa isanitizer, futhi sigcine indawo esihlala kuzo zihlanzekile. Siyafisa ukubonga ukuthi abantu bakithi bonke bayawasebenzisa ama-mask, kodwa kusiphatha kabi ukuthi abanye abantu sibathola besebenzisa ama-mask ukukhava intshebe nezinye indawo. Kodwa siyafuna ukugcizelela ukuthi i-mask ayikhave imlomo nekhala, sizivikele ngesikhathi sonke. Siyabonga. Wena kubuye ufake nasemehlweni.